Hello, my name is Ben Gibbison and I'm a consultant anaesthetist at the University Hospitals Bristol, as well as a research associate at the University of Bristol. The University Hospitals Bristol NHS Foundation Trust is a large teaching hospital and is very research active. This research aims to answer important clinical questions regarding patient care and outcomes. For studies to be carried out, a large team of research staff need to work closely with the clinical care team. I'll now try and give you an insight into one of these studies, the cortisol study, where we try and understand what's happening to cortisol levels after heart surgery. When you sprain your ankle, it becomes red and it becomes swollen. It becomes red because the blood vessels get bigger, and it becomes swollen because all the fluid leaks out of those blood vessels and into the tissues. This is called inflammation. This same inflammatory reaction happens after heart surgery, but across your whole body. This means that some patients can end up in a state whereby there's not enough fluid going around their blood vessels, giving them low blood pressure and swollen organs. And this means that some of them can spend a long time on the intensive care unit after their surgery and even die. One of the hormones that protects us from this inflammation is the steroid hormone cortisol. In the same way as steroids damp down inflammation if you have a swollen ankle, they can also reduce the inflammation after heart surgery. We're taking very frequent blood samples from people on the day of their heart surgery to see the pattern of cortisol in their blood. This is important as it's not just the amount of cortisol that's produced that is important for it to function, but the pattern as well. Our early results have shown that people produce much more cortisol after heart surgery, and more importantly, the pattern has changed. The pulses are much bigger and there are far fewer of them. The aim of this video is to give some insight into what it might be like for a patient taking part in a clinical trial, and also to demonstrate some of the teamwork required to support this. Some patients with heart problems may be referred by their GP or cardiologist to come and see a cardiac surgeon at the outpatient clinic. At these clinics, the research nurse identifies patients who may be suitable to take part in a research study. Each study has different inclusion criteria, and the cortisol study is looking specifically for male patients coming in for coronary artery bypass grafting. Once a suitable patient is identified, a trial coordinator will send a patient information leaflet to that patient. This will allow the person time to read about the study and think about things like the risks and benefits, and to have a chance to talk to friends and family about taking part. The research nurse will approach eligible patients when they attend their pre-assessment appointment and answer any questions they may have, and ensure they fully understand what taking part in the study involves. If the patient is interested in taking part, then the nurse will explain the consent process and ask them to sign a specific consent form. On the day of admission, the research nurse will confirm the patient's eligibility and that they are still happy to participate. On the morning of the operation, the study coordinator informs the theatre staff that the patient is taking part in the study. Theatre staff will have already received training on specific study procedures. The patient is taken to the operating theatre and prepared for surgery as usual. The first study sample is taken in the anaesthetic room. Hourly blood sampling continues over the next 24 hours. The research nurses and intensive care nurses facilitate the collection of these samples.
Hi Kirsty, here's the next cortisol study sample for you.
Brilliant, thanks very much.
Thanks very much.
Blood samples taken at each time point are sent up to the hospital laboratories for analysis. Serum, which contains the cortisol hormone, is extracted from the blood samples. This is placed on an automated analyzer which measures the exact level of cortisol in each sample, and the results are recorded on a trial database ready for analysis. Patients undergoing major heart surgery usually stay in hospital for an average of 7 days, where they are carefully monitored by the clinical care team and by the research nurses. Also during this time, study data is collected.
Hi there, how are you feeling after your cardiac surgery?
Very tired, very sore, but so pleased it's all been done, and it's such a great relief, and I don't know what to say.
How was your experience of being part of the clinical study?
Well, they was all very friendly and explained everything that you're going to do. There's no obligation or anything like that, so it was very easy to, come along with them. It's brilliant.
Did it bother you having blood taken so frequently?
No, it didn't bother me at all, because they explained everything what I was going to do, And I was under the anaesthetic anyway, so it didn't bother me in the slightest. No, I couldn't see any reason at all around that. It didn't bother me.
Are you glad that you took part in the study?
Oh, of course I'm glad. It's going to help. That's what it's all about. And, you know, in the future, possibly be able to help all more again.
At the end of the recruitment period, all data will be analysed and the results published. Patients who would like to know about the results of the study will be sent a summary showing the study findings.